If you're expecting a baby in Brazil and you're confused on whether to use the private healthcare or the public healthcare, keep watching. Hey guys, welcome back to my channel. It's your girl Mills and I'm back with another video. So today I'm going to be talking about birth in Brazil, and I'm going to be talking about the public healthcare and the private healthcare. Whichever one you want to use is up to you. Most people are always confused which type of healthcare to use. Brazil has one healthcare system, be it public or private, especially when it comes to childbirth. It's good, although we have a few disadvantages. When it comes to healthcare, there are always advantages and disadvantages. So I'm just going to give you the difference between both healthcares. So I'm going to start with the first one, which is the most important one, which is the cost of birth. When it comes to public healthcare in Brazil, it's a universal one, which is being funded by taxes. And it offers free healthcare services to everybody who is present in Brazil that wants to get access into this service. This is actually free for everybody who wants to use. And it includes childbirth, from the checkups, antenatals, birth, and the time you spend at the hospital, even after the hospital, postnatal, and everything. It's actually free. When it comes to private healthcare, you actually need to pay for the service, especially when it comes to childbirth. In the private healthcare sector, there is what you call the maternity package, that you pay for everything: the consultation, the tests, visitation, the birth, and maybe post-birth, the antenatal and postnatal. So you need to look at the different options of the package to know the amount. Cost of birth in the private hospital depends on the location where you are, because most of the private hospitals are in different grades. The more popular the hospital is, the more costly the hospital is. Prices for the maternity package always ranges from 10,000 reals up to 30,000 reals plus. Here in Florianopolis, the few private hospitals that we have here, you pay 10,000 plus. The most popular private hospitals are found in Sao Paulo, so the birth package is more expensive. You'll be expecting 30,000 plus. Let's go to the next one, which is the services. The way they do the entire birth process in the public healthcare is completely different from the way that the private hospital would do. In the private sector, all the services are being carried out in a package which is done in the hospital. It's organized. It's the test and everything antenatal in the public hospital is being done at the center, and the birth is being done at the hospital. The birth might be carried out in any public hospital, so the services that we provided will be different. I want to talk about the birth. So we have two ways of birth. You have the normal birth and you have the CS, which is an acronym for cesarean section. So for the public hospital, 80% of the times they always want you to give birth normally, except one or two complications come up, then you'll be rushed to do the CS. CS can also be done in the public hospital, but it depends on the situation of their entire pregnancy journey. During the antenatals, checkup and everything, if they discover that you have a risky pregnancy or your pregnancy has some complications, they're going to opt for CS. And also for those who have multiples, for the private healthcare, you can opt from day one. Even if you have a normal pregnancy, you can still decide if you want to give birth normally or you want to do CS. It's up to you. So you have an upper hand with the private sector. For normal birth in the public hospital, they don't give the epidural, but in the private healthcare, you can opt for that. During the birth in the public hospital, their services are a little bit slower than in the private hospital. That's because in the public hospital, there are too many people who are giving birth, so there might be a lot of wait times. I remember for my first son, I had to wait for a very long time because they're trying to finish up with the people in their maternity room for me to get in. I had to do all of my labor period outside in the waiting room. But in the private hospital, you'll be attended to like almost immediately, as well as majority of the times they only admit you in the public hospital when you are 5 centimeters dilated. But in the private hospital, even if you're not yet 5, there's going to be a follow-up. Next one is communication. When it comes to communication, it's more in the private healthcare than the public healthcare. You can communicate anytime with the doctors, the nurses, the midwives, but in the public healthcare, the communication is limited. You only have to go for your antenatals, your tests, and all of that based on appointments, as well as you only go to the hospital when it's time for you to give birth. That direct communication with the doctor is limited. For the private healthcare, you can have only one doctor that will take you through until the end of the birth. But in the public hospital, every time you go for appointments, you can even meet different doctors, and when you go to the hospital too, you're going to have a different doctor for your birth, so they will just change. Also, when it comes to communication, let's talk a little bit about the language. For the public healthcare, 90% of the times is going to be Portuguese that's going to be spoken. You might be lucky to meet maybe doctors that can speak English or Spanish or French or any other language that you speak, but then you're going to be attended to. Even if you don't know how to speak Portuguese, they're going to try to look for someone that can speak the language that you can speak. But there's going to be a barrier with the communication. But now when it comes to the private healthcare, most of the private doctors actually do speak multiple languages, as well as if you want, they're going to provide you with services that will go with the language that you can speak. The next one is visitation. In the public healthcare, you can actually visit the hospital that you want to give birth in, but the visitation is going to be limited because you can visit the hospital that you want to give birth, but you cannot actually visit the different areas. You can only end at the place where you do the inquiry. But in the private hospital, you can actually visit and see how the rooms are, see how the maternity wards are, see how the hospital is. You can be shown around. Next one is the rooms. So I want to talk about the rooms as in the maternity ward as well as their birth ward. First of all, when it comes to the birth, depending on the area where you're going to be giving birth, there's some hospitals that have shared rooms. When I mean shared rooms, it's like you'll be giving birth with other expectant mothers, and later on, even after birth, you're going to be sharing spaces with other nursing mothers. And there are some public hospitals that you have a room by yourself that you're going to give birth there. So it all depends on the area where you are. I gave birth to my first son in Sao Paulo, and I had just one room for myself for the birth, and after the birth I went to a room that was just 2 of us. But in Florianopolis, when I gave birth to my second son, during the birth we're 4 of us, and after I gave birth we're like I think 4 too in the ward. But in the private hospital, you're going to be alone in your room. Next one is the options. The public healthcare has more options than the private healthcare because in majority of the states, you have fewer private hospitals than public hospitals, because in every neighborhood, you have a public hospital. Most of the cities have very few private hospitals, so the options are really limited, as well as when you pay for the package, you are stuck with that hospital from start to end. But with the public, you can decide, okay, I'm going to give birth here, but later on you change your mind to change the hospital. You have many options. Then the last one is accessibility, so easy access. Of course, the private healthcare is easy accessible than the public healthcare. There are many things that you can get access to, the services, the communication, the doctors, and everything is easily accessible accessible in their private hospital than in the public hospital. Giving birth using any of their two healthcare system really doesn't matter. At the end of the day, it is being generalized as Brazilian healthcare system, and all of it is the same. So it's up to you which one you want or which one you think you feel comfortable. If you have any further questions, leave in the comment section. Please don't forget to like, share, and if you haven't subscribed to my channel, please subscribe to my channel and hit the notification bell so that I get updated every time I upload a new video. In that same light, ciao.